Ear infections. An ear infection, also known as otitis media, is an infection of the middle ear, which is the space behind the eardrum that contains the small bones that help transmit sound. It can be caused by bacteria, viruses, or fungi, and often occurs after a cold or flu. Symptoms of an ear infection may include ear pain, fever, trouble hearing, and drainage from the ear. Ear infections are common in children, but can also occur in adults. Treatment may involve antibiotics, pain relievers, and in some cases, surgery. Seek medical attention if you suspect you have an ear infection, as untreated ear infections can lead to complications such as hearing loss or mastoiditis. What causes an ear infection? Ear infections are typically caused by bacteria or viruses that enter the middle ear. The middle ear is connected to the back of the throat by the eustachian tube, which helps to equalize the pressure in the middle ear and drain fluid. When the eustachian tube becomes blocked or swollen, fluid can accumulate in the middle ear, providing a breeding ground for bacteria or viruses. Common factors that can increase the risk of developing an ear infection include age. Young children are more susceptible to ear infections because their eustachian tubes are shorter, narrower, and more horizontal than those of adults. Upper respiratory infections. Cold, flu, or other respiratory infections can cause inflammation and congestion in the eustachian tube, increasing the risk of ear infection. Allergies. Allergic reactions can cause inflammation and swelling in the eustachian tube, leading to fluid buildup and an increased risk of infection. Smoking. Exposure to secondhand smoke can irritate the lining of the eustachian tube, making it more susceptible to infection. Changes in altitude. Rapid changes in altitude, such as during air travel or scuba diving, can cause changes in pressure that can affect the eustachian tube and increase the risk of infection. Note that not all ear infections are caused by bacteria or viruses. In some cases, an ear infection may be caused by fungi or other less common organisms. How can you prevent an ear infection? While it's not always possible to completely prevent ear infections, there are steps you can take to reduce your risk. 1. Keep your hands clean. Frequent hand washing can help prevent the spread of germs that can cause ear infections. 2. Avoid smoking. Exposure to smoke can irritate the lining of the eustachian tube and increase the risk of infection. 3. Breastfeed your baby. Breast milk contains antibodies that can help protect your baby from infections, including ear infections. 4. Stay up to date on vaccinations. Vaccines can help prevent infections that can lead to ear infections, such as the flu and pneumococcal disease. 5. Manage allergies. Allergic reactions can cause inflammation and swelling in the eustachian tube, increasing the risk of infection. Talk to your doctor about allergy treatments if you are prone to allergies. 6. Practice good hygiene. Clean your ears regularly with a washcloth or tissue, but avoid using cotton swabs, which can push earwax deeper into the ear canal. 7. Avoid sharing utensils and drinking glasses. Sharing utensils or drinking glasses can spread germs that can cause infections. 8. Treat upper respiratory infections promptly. Upper respiratory infections can lead to ear infections, so it's important to treat them promptly and effectively. Not all ear infections can be prevented, especially those caused by genetic or structural abnormalities in the ear. If you are prone to ear infections, talk to your doctor about additional steps you can take to reduce your risk. How to treat an ear infection. Treatment for an ear infection depends on the severity of the infection and the underlying cause. Here are some common treatments for ear infections. Pain relief. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help relieve ear pain. In some cases, your doctor may prescribe stronger pain medication. Antibiotics. If the infection is caused by bacteria, your doctor may prescribe antibiotics. It's important to take the full course of antibiotics as prescribed, even if you start feeling better before you finish them. Eardrops. If the infection is mild, your doctor may prescribe eardrops that contain antibiotics or steroids to help reduce inflammation and swelling. Decongestants. If the infection is caused by a cold or flu, your doctor may recommend a decongestant to help relieve congestion and open up the eustachian tube. Surgical intervention. In some cases, surgical intervention may be necessary. This is typically reserved for severe or chronic infections that don't respond to other treatments. It's important to see a doctor if you suspect you have an ear infection, especially if you have severe pain, high fever, or other symptoms such as hearing loss. Left untreated, ear infections can lead to complications such as hearing loss, ruptured eardrum, and spread of infection to nearby structures.